Howdy again, everybody. This is Doc with ThoroFan, and of course, earlier this week we were struck with the tragic news of Kentucky Derby winner Medina Spirit collapsing and dying after a 5-furlong workout out at Santa Anita. And of course, there's been a lot of questions that have been circulating since then as to what could have happened, what might have happened. I did try to explain in a couple of earlier videos the process, at least, of what's going to happen now in trying to determine the true cause of death and if we can figure out what's going on. But there's been a lot of questions lately about these sudden cardiac events in horses, and can we determine them and can we predict them potentially if this is what happened to the Medina Spirit. So come along with me as we spend a little bit of time dissecting and discussing sudden cardiac death in racehorses. So what we do know about the Medina Spirit tragedy is that it was not due to a catastrophic injury. It was not due to the breaking of a bone anywhere or the breakdown of the suspensory apparatus, as we've covered in previous videos. That is the most common thing that we see when injuries occur on the racetrack that lead, unfortunately, to a horse having to lose their life. This is what was known as kind of a sudden death. And usually in horses on the racetrack, that is due to one of two things. Either a major bleed out from a large vessel, so the aorta rupturing, or a very large pulmonary vessel rupturing, causing basically a very, very fast internal bleed. And when that happens, there's really nothing you can do. Sort of like an aortic dissection in humans that you hear talked about every now and then. Not quite the same thing in the fact that normally the vessel fully ruptures as compared to just kind of breaking on the inside. I was made aware through another colleague on Twitter that there is some research going into if there is kind of a genetic predisposition to a weakening of some of these vessels and the collagen or things that kind of hold the vessels together in racehorses from some of the inbreeding that has gone on for generation after generation. And that's still kind of in the research phase. There's really no causality definitively there yet. They've noticed a correlation maybe, but no definite causality. So normally it's just something in the horse that is weak and that causes them to rupture under maximum exercise load and things like that. So that's one thing. And remember, this is not the same, especially if it's a pulmonary vessel, this is not the same as exercise-induced pulmonary hemorrhage, or bleeding as we commonly call it in racehorses. That's usually bleeding on a much smaller scale through capillaries. We're talking about a very large vessel rupturing and causing severe internal bleeding that leads to death in this case. And that would be something they would be able to determine pretty quickly on necropsy when they look at the pulmonary vasculature and the vessels around the heart, things like that. They would be able to determine fairly quickly if that was the cause of death. The other thing that happens is what's known as a sudden cardiac event. A lot of times it's known as a fatal cardiac arrhythmia. And of course, everybody kind of knows that the heart usually chimes along at a regular beat, lump dump, lump dump, lump dump, with the contraction of first the upper two chambers of the atria, and then the contractions of the ventricles below in a very rhythmic pattern. And this is called normal rhythm or normal sinus rhythm. And people have to remember that what triggers all of this is electrical impulses. So there's an electrical impulse that starts at a certain portion of the heart, and then that impulse spreads across the cardiac tissue, usually the atria first, causing the muscles, the cardiac muscle cells there to contract first. That pushes blood down into the ventricles, and then the electrical impulse spreads in a very methodical pattern through the ventricles, causing them to contract in a certain way to then pump blood either to the lungs or the rest of the body, depending on which side of the heart you're talking about. Now, this is something that we can visualize in a way from seeing the normal rhythmic contraction of the heart. However, we can't visualize the actual electrical impulses going through. Nobody can see electricity going through the air unless you have one of those fun little gadget things. You might see a spark here or there, but for all intents and purposes, you can't see electricity flying through the air or flying through a substance. So we rely on what's known as something that probably everybody's had at some point in their life, what's known as an ECG or an EKG, where they actually measure the electrical impulses tracking through the heart. And so they'll do this by putting probes on certain areas of the horse, and then they'll follow that electrical activity, and that makes that very characteristic kind of spike graph that you see on all the shows and on ribbons and things like that. And that's what's considered a normal rhythm. Now, we can pick up if we happen to have the electrodes on at the time, what's known as an arrhythmia, or an abnormal heartbeat or heart rhythm. And so that can look very different depending on the type of arrhythmia that's present. And horses can be prone to developing certain types of arrhythmia, and we can see that on those electrocardiographs. We sometimes can hear it too as the heart not contracting in a normal fashion. So we hear kind of, you know, a dump, da-da-dum, dump, 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 lump, dump, da-da-dum, 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 dump, and those types of things. So we're not hearing the normal sound progression, and we can suspect that arrhythmia is going on there. The only way we truly can diagnose an arrhythmia is by having those electrodes on and seeing it at the time. Now, this is why it makes so hard to determine sudden cardiac death because of fatal arrhythmias, difficult to find post-mortem or after the horse has died, because there's no trace of it. There's no evidence of it on the heart physically that we can see. Usually there's no evidence of it even microscopically when they look at heart tissues and things like that, unless they notice a difference in the microscopic cell structures of the heart or something that might give them an inkling, hey, you know, these heart cells aren't constructed the same way, or something looked to happen to them, so the electricity may not have flowed through at the exact rate. The only way we can determine for truly that it was a arrhythmia causing the cardiac arrest or cardiac death would be if that kind of monitor was on the horse at the time of collapse. Then usually those monitors go back a little bit, and we're talking about, you know, common halter monitors that some people will wear for 24, 48 hours on themselves if your doctor suspects you have an irregular heartbeat, but it's not showing up all the time, and they're trying to see if they can pinpoint exactly what's causing it. They do exist for horses, and we have used them on horses, but obviously you can't keep something like that on a horse all the time, and if there's no previous evidence of the horse ever having an issue in a workout or a race, having any kind of weakness or difficulty moving around or even potential collapse after a workout or a race, and the veterinarian who's listening to the heart doesn't hear any irregular heartbeats, there's really no reason to necessarily suspect it's going on. So we don't routinely keep those monitors on horses. But as I said, if you don't have the monitor on at that time, you really don't know if it truly was a fatal arrhythmia. And there's a lot of things that can cause that. It can be a structural deformity in the heart that maybe is on a minor level that just didn't cause enough trouble in his previous races or workouts that then all of a sudden causes a problem, and that leads to the electrical disturbance, and that leads to a fatal arrhythmia, so where the heart can't pump normally anymore. Electrolyte imbalances sometimes can do it as well. So if the specifically calcium or potassium amounts in the horse or person or animal or anything is off a little bit, that can lead to irregular kind of discharging and irregular contraction of certain heart muscle cells because they do rely a lot on calcium and potassium to be in the right ratios to be able to contract and conduct electrical impulses normally. So if those are off for whatever reason, there was something else going on with the horse. Sometimes people look at potential drug issues here. If something as simple as Lasix was throwing their electrolyte balances off a little bit, it might affect things with the heart as well. So that's certainly a possibility too. It could just be that it was just something that hit, and we will never understand the reason why. And these are the most frustrating cases for us as veterinarians because we always like to have a cause, and we want to be able to see what's going on. And as I said, in necropsies and even on microscopic looking at heart tissue cells, a lot of times you may not be able to determine it. And a lot of these horses that suffer these sudden cardiac deaths, we don't know exactly what happened. Despite all the testing out there, despite all the ability to look at things under microscopes and electron microscopes and doing all of these fancy testing that we now can do, we just sometimes don't know. All we know is that the horse died, and we will never find the exact cause. So I say that just so that people are aware a little bit that we may never get a true cause of death in this Medina Spirit case. Hopefully we will, which will put an answer to a lot of the questions that are out there. But there still is that possibility that everybody has to realize that because sometimes these cardiac events are electrical in nature, you just don't see it, and you don't see evidence of it either, and that can make it really hard and frustrating. And believe me, there's a lot of research out there trying to determine if we can figure out a way to see these things after the event has happened. And right now, the only way to really see them is with those monitors on looking at the electrical activity of the heart at the time. So that's kind of where we stand, and that's kind of a brief overview of what happens in these cardiac death cases. And hopefully, they will find something that may lead them in the right direction. As I said, if it was due to a major bleed, that would come out, fairly quickly. But they will look at everything. Trust me, the pathologists at UC Davis are top of the line, and they are going to leave no stone unturned, no cell unturned in trying to determine out the cause of Medina Spirit's death. And remember, these types of things, these necropsies, they're done on every horse that suffers a death on the racetrack. Medina Spirits is, of course, going to attract a lot more attention because of the fact that he was the Kentucky Derby winner and because of who his trainer is with Bob Baffert and the history of medication overages and things like that, and the history surrounding him as a trainer. So that's going to attract a lot more attention in the media. I just read something about saying Dianne Feinstein, the senator, again, is really interested in this and wanting a full, thorough investigation into everything. So his case is probably going to get a touch more scrutiny veterinary-wise and medical-wise than the average horse that suffers this type of death at the racetrack. But a lot of the steps are going to be the same, regardless if it's a Derby winner or a claiming horse that goes down. We want to get to the answer, and the same level of necropsy detail is going to be done on both those types of scenarios. So I hope that answers a little bit about just, why we sometimes have these cardiac deaths and we don't know why. And of course, we'll be following this at ThoroFan and seeing, any new information that comes out. If there's anything new that pops up from the veterinary side, we'll of course jump on and give a short, brief video on it just to try to explain it so everybody understands. But again, our condolences go out to everybody who loved Medina Spirit and, the horse that just kept trying and trying and unfortunately suffered this, untimely demise. So that's going to about cover it for this section. I am Doc for ThoroFan, and of course, if there is any information that you need to know as a racing fan, there's only one place to really turn for the most accurate and up-to-date information for you, the racing fan, by us, the racing fans, and that's right here at ThoroFan.